Morning students, how are you all? So today we are going to see about IMNCI, which is an important topic that is about integrated management of neonatal and childhood illness. It is important for exam point of view also. Every year more than 10 million children die in developing countries before they reach their 5th birthday. 7 in 10 of these deaths are due to 5 preventable and treatable conditions, that is pneumonia, diarrhea, malaria, measles and malnutrition, and often to a combination of these conditions. 3 out of 4 of these children suffer from one of these 5 conditions. So because of that, lot of childhood mortality is there and it's increasing. So it is very important. The reason behind why this mortality is increasing is because of the family members, the mother or other family members or caregivers are not aware about the disease complications and issues that can happen to the disease. It is complicated. So when to go to hospital, when the child has to be taken, provided with the treatment, hospitalization, that is not aware about this. So even when we go to community, we can see the child with pneumonia that is too severe, and the parents are not taking the child to hospital and saying that sickness will get off within a day or within a week. So they are just giving medications at home itself and managing. But how severe it is, even death can happen if it is not taken care of. So it is very important to family members and the public community people must be made aware about the diseases that can lead to mortality. So that is why the government, WHO, have initiated this program, and our country, government of India, have undertaken this program, and it is running very well to prevent childhood mortality. So why newborn in India? What is the status? First hour, first day, first week, first month. What is happening? The reasons for delay in assessment and accessibility of newborn to reach healthcare settings. Starting of a problem, delay in recognizing the problem, home-based treatment, delay in selecting the health facility, treatment from traditional advisors and village doctors, delay in selecting a formal health facility causing delay in treatment and increased cost, increased chances of death of newborn. So these all are the causes why neonatal and childhood mortality is increasing in our country. So these are the issues. So keeping in mind these issues, what we can do, that's how we have initiated this IMNCI program. What is IMNCI? It is an integrated approach to child health that focuses on the well-being of whole child. IMNCI aims to reduce the death, illness, disability, and to promote improved growth and development among the children under 5 years of age. So what is IMNCI means? I means it is an integrated approach. So what all things are integrating? There are the management processes there, and it is an approach, and that the target is neonate and childhood illness. So all 0 to 5 years of kids are the target, and all the illnesses that is occurring to these target groups are being focused and addressed, and how to manage these are being taught to the general public. So IMNCI include both preventive and curative elements that are implemented by families and communities as well as by the health facility. So it's not only the health professional must know about IMNCI, even the family members and the community people, caregivers, all must be aware about this. Then only we can manage and prevent these childhood and neonatal illnesses. Coming to the strategy, it includes main 3 components. First one is improving the case management skills of healthcare. So first thing under this IMNCI is to provide Management skill of healthcare staff. So first is we are providing training for the healthcare staff, that they must be more skillful enough to identify the cases and treat the cases. So in that way, healthcare staff is first trained, improving overall health systems. And the second one component is overall health system is being made aware about this Imnci. Third one is improving family and community health practices. So third part, we are making awareness into the family and the community level and asking them to practice this Imnci. Thereby we can reduce a huge amount of morbidity and mortality rates, which is our target in all the schemes and policies. Principles of integrated care. All sick young infants up to 0 to 2 months of age must be assessed for all the symptoms. So we can say that main principle of this Imnci is we are dividing first the kids into two categories, that is 0 to 2 months and 2 months to 5 years. So each category of age group there are different type of diseases that is being seen. So according to the child category, we are dividing into 0 to 2 months and 2 months to 5 years. After dividing them in such categories, second part is we are identifying the general danger signs and identifying. So these danger signs like cough, breathing difficulty, diarrhea, fever, ear problems, and that will be varying from two categories. In 0 to 2 months, we have the common danger signs are bacterial infections, jaundice, diarrhea, whereas in 2 months to 5 years, the general danger signs are cough, fever, diarrhea, fever, and breathing difficulty, ear problems. So accordingly, the danger signs will be varying, and that has to be informed, and the family members must be aware about these danger signs. And that is being assessed, and proper management is taken from the as per this Imnci category. So it is being a combination of individual signs leads to child's classification rather than diagnosis. So based on the child severity of the disease, it is and the treatment modality, it is divided into three color codes. If it is pink, needs urgent hospital referral or admission. And if it is yellow color, that means medical treatment and advice is needed. If it is not severe, then it is a green color code, that means the child can be managed at home. So based upon these three color code, we are providing these Imnci health services. Coming to the elements of case management process, so these are the 6 points that is coming under these elements. Elements are very important under this Imnci. What we are doing, so that is called as management process. First we are assessing, then we are classifying, identifying, treatment, counsel, and follow-up care. Under the assessment, the child by checking for the danger signs by the history and examinations. You can underline danger signs are assessed by history collection and by physical examination. So we told each category, each age group category, there are variations in the danger signs. So accordingly, if the child is 0 to 2 months of age, then what is the danger signs, and what is the history, since how long the child is suffering with this, and the physical examination has to be done. Then next second point is classifying. So after that, based upon the color code triage system, we have to classify according to the severity of illness. Then you have to provide the treatment, that is identify specific treatment based on the color code. Management has to be taken. Treatments, that is the instruction of oral drugs, feeding, fluids. So whatever is the treatment based upon the color code, it has to be implemented. Next is counsel, mother about breastfeeding and about her own health, as well as to follow further instructions on further child care. So on all these aspects, counseling must be given. Follow-up care, reassess the child for any new problems. So this is how this Imnci process is moving on. That is assessment, classify, identify, treatment, counsel, and follow-up care. So just in a single glance, I'll give once more a brief explanation through the schematic diagram about the management process. First, we have to check the danger signs. That is, for example, danger signs can be convulsions, lethargy, inability to breastfeed or drink, vomiting, etc. based on the age group. After checking the danger signs, we have to assess the main symptoms like diarrhea, fever, ear problems, breathing difficulty, etc. then we have to do the physical examination or assessment, that